A lot of people get confused about exactly how it is that a tummy tuck is done. First, we need to make an incision across the lower tummy from hip to hip. Now that incision can go almost anywhere you like. I personally like to make it in the center, about 6 centimeters above the vagina. On the sides, that really depends on the bathing suit that someone wants to wear. We make an incision along here, and we begin to pick up the skin, and we separate it away from the underlying muscle. We're working right along that surface until we get up to the belly button. This is just the surface aspect of it, but underneath the skin, it actually is attached and goes down inside of your abdomen. At this point, I make an incision around the belly button, and I continue elevating the skin, and the belly button stays behind and just kind of hangs out here in the breeze. And we continue elevating the skin. We want to get all the way up to the xiphoid process. So here are her muscles. These are called tendinous inscriptions. And in the center here, I put a little bit of tape just to try to represent that a lot of people have a separation in their muscles. The next step in this operation, again with the belly button hanging out and it does not move, is to tighten the abdominal muscles. It works when we talk about tightening the muscle is we close this gap in between the right and left rectus abdominis muscle. We slowly close the gap between the muscles. We're bringing them back together in the midline where they belong, where they were before you got pregnant or gained weight or whatever it is that happened to you. So as you can see, the yellow tape down here is getting buried because I'm bringing the left and right sides of the abdominal muscle wall together in the midline. So any separation in the muscles is getting eliminated. I've got to bring this all the way up to the xiphoid because if I leave one part of the repair undone and the patient takes a deep breath or has a big meal, this part will stick out. So you really need to get the entire length of the abdominal wall. You see there's still this gap down here between this muscle and this muscle, so I have to repair that as well. And we try to come close to the belly button, but we don't want to squish the belly button too much or else you can end up with trouble. Every once in a while you hear about a belly button that died from a tummy tuck, and that is usually because of this step. If the stitches are too close and they choke the blood supply to the belly button, that's big trouble. So now we've repaired the diastasis recti, that's the muscle separation from the top all the way down to the bottom. The muscles are repaired, the belly button has not moved. It's a little bit tighter now because we've snugged up the muscle around it, but it hasn't moved at all. So the next step is to remove our retractor and take away the extra skin. All of this lower abdominal skin is going to be removed. So I'm going to trim all of this and then we're going to close it. We typically sit the patient up into a beach chair position and so that I can close it without very much tension. I need all of this skin to come down here. This is where the belly button used to come through, but we've decided that there's too much loose, crummy skin over here with stretch marks and whatnot sometimes. So we're going to take that away. So I would have measured it and been very careful, but this is essentially how it's done. This is the part that gets discarded. Now we've got a big gap in the bottom. I need to take this skin and pull it all the way down. Her pubis is going to get elevated while her tummy skin here gets pulled down. So we're going to take this skin, which began just above the belly button, and we're going to pull it all the way down to the pubis. Now, roughly 40, maybe 50% of the tummy skin has been removed. The abdominal muscles have been tightened, but she's got no belly button. Right now, everything is flush here that you can't see her umbilicus. Now I have to go and make a new hole in the skin so that I can bring the belly button back out to the surface. Now this is really important. The placement of the hole, if I make it too high, make it too low, that matters. The size of the hole is tremendously important. Personally, I like to make the hole about the diameter of my finger. But the way that we do it is to make an incision here in the surface. And then I bring the belly button out and I sew it in place. Now the way that I sew it also matters, but yeah, I like to make the belly button more of an innie. I try to give it a little hood. I try to cover the superior 3/4 of the incision around the belly button. I try to bury it so that you only see a little scar underneath the bottom of the belly button right here. But in its essence, that's how a tummy tuck is performed.